Edia, Timothy, and Uncoto, era one radio. Oh, and Pampuma, Asam Pampuma, and Ratumuma, era one, Yellow Pampuma.
Seventh-day Adventist Church, the new Tafu members in the diaspora virtual homecoming, 3rd edition, coming up Saturday, September 10, 2022. Time 10 a.m. EST, 3 p.m. UK time, and 4 p.m. EU time. Aquarium 4, Adofonia Busia Wachichini Benchaye, a Brenner draw. See a Posua near to Fapimpa, my Yakui, then I'm Saya so I'm a Puntu Duma Hodua, Yafati Onsono, a frat Dumo Dumo Kunim Diemu. The new Tafu members in the diaspora virtual homecoming 3rd edition. Afe 2022 idea, a bear song cry. Jumedian bear crabbe, and Yum Tofu a Kukudam, Behui and Yum Papabi, Asidania Dancia Sombetuja, Nashayana Jawa so young Cropon Tredian Pabasai Free and and now say young coupon near a genie. Kai say a fee a bear fundraising, Nebek him, a bear bone.
Nebusia for the say share you. Yeah, and now there was seeming in a drink come if car be for diabetes one. Now and then so about twice. Now, person bomb kaya diabetes no man a king kai and a king can was him. Say bit me the boy and home buying. You can say diabetes ya Arabia. A dose to be brave or you create more American. If you are seeing Fanangina, Cophobia brave or Harmonia diabetes, ya diabetes. You can like Casa when you trick us and want to say a situation area. Now, and no maybe why am I putting at risk? And I said, Bonnie because I put you at risk, and I said, Bonnie because and then a mass a yes, a Yariano. So I show here no one you when fish are no man who are a bit him west many as I are. You can say no money being say, you say, yeah, before it are in your diabetes, you be saying, a friend saying ethnicities be brave. Then so no cry and tosana. If you are my ebusia phobia woman, maybe I'm in a moon in a moodam and I'm yanking in one. I say, because I die in genetics. We are not to China, and no more high bit my boy. A moody decan Cassian say, Yan Cassian brosu bebre. Bonibacas obesity. Intina, sit me checking and waiter. A quite be a bit media boy checking and waiting. A boy my 80 me. A boy to me tree and who free diabetes one. Just toss me no, say. Yes, sir, obesity in qua a diania ye, a diania dear who hear ye. Who says, "I hear who ye eat more vegetables and fruits now." No to me, boying a tree and free diabetes, what quite be brain home. It means who's a task course who be say exercise be brain yet in train up more. And no boy or quite be brain, so my 80 me a tree and who free diabetes. So, Enna, your sounds to see a biome to say, Yen die dano, your double swat and yet. Yanda be brave and dance one man and see penny, say, see penna, sitting a couple and say, to me, Dana, and soon to me, and shoot me, my 8 me a year at risk. Into no, young pens and pens and more, but says, say, be a old to me, that bear 7 to 8 hours, and I do be a bois ye. And I think so, you whom no man be brave, come home, your friend say, whom he has said, you bet call up and doctor. And I say, yeah. Upon ye, therefore, a moment, Dr. Juma, Munim, met my checking every year, dear, and say, I won't be on your corner. You're checking in, your moja, you're checking in pressure, you're checking on vibrate. I say, I no more, a bit me, say, be I say, I'm paying you crass, be a being at a cry, be home in Ntim, yet to me, day, up by home buying, because woman in Tama. You know, bit me, I no maybe and a bit many treatment be a bit more boy, I better prevent when ya complications. And they say, complications na ɛho hia yie. Yɛka complications no asɛm sɛ yɛka sɛ dedi kan etimi ma yɛtumi obi onya diabetes a wanhwɛ ne yie a ne sugar ne tabia na ɛwɔ so no sikyɛ no wɔ so no etimi affect n'ani etimi yɛ koraa bɔ sɛ na ohun adeɛ biom. Yɛsa ka biom sɛ etimi affect yɛn kidneys a ɛboa yɛn ma ɛyi anomabɔne free yɛn mogya mu no etimi affect kidneys no nti wɔn sɛ anyɛ yie a na afei na nipa kɔ no koraa ɔkakɔ ehia sɛ ɔbɛyɛ dialysis. Nti ɛno yɛ ɛnoma mmienu etimi kɔɔso na nyɛ no nko a yɛsan so hu sɛ diabetes deɛfoɔ yi sɛ yɛambɔ yɛn ho ban a etimi ɛma yɛtimi yɛn ntini na yɛde inya feeling wɔ yɛn nan mu no ɛno nso timi yi firi hɔ no eyi firi hɔ saa na kyerɛ sɛ deɛ ɛbɛkɔ so no sɛ nan no wontimi nya feeling wontimi nya obi bibi yɛ wa wontimi nya the first sensation no nti no ebinom betumi awi aseɛ no na ebi a your friends say manya kuro bi wɔ nan na ɛsɛ kotwa mo nan enso hɔ no ma yɛtumi nya heart attack and etimi ma yɛsɛ nya stroke nti na ɛho hia yie sɛ ɛnɔma a yɛbɛtumi ayɛ abɔ yɛn ho ban titiriw aduane a yɛdie woyɛ no to nkyɛn a sɛ yɛbɛtumi apɔ mu every day broni ka sɛ anaasɛ nhwehwɛmu akyerɛ sɛ so otimi woyɛ exercise 30 minutes just 30 minutes 5 days a week a etimi boa yie nti no so yɛyi saa noma wei nyina firi hɔ no ma na yɛ sɛ yɛpɛ sɛ yɛtenten apɔ mu na yɛtimi yere yɛn ho na yɛtimi bɔ yɛn ho ban free diabetes saa sɛ ebi a ya diagnose with diabetes saa noma wei nyina nkɔma nkrɔfo a mpɛ sɛ mo prevent diabetes nko but ebi kora ya diagnose with diabetes kora so a ɛno nso timi boa yie nti ɛna ɛka ho asɛm bɛyɛ sɛ bosom yɛ atwa mu no na sɛ ɛna deɛ no deɛ mede ma mo no ɛyɛ yare bi a yɛfrɛ no prostate cancer nti yɛbɛka prostate cancer ho asɛm nti no mmerɛ di anim kakra no yɛbɛdi nkɔmmɔ afa prostate cancer ho deɛ di kan no na ɛho hia yie paa nti no saa prostate cancer ɛyɛ a bosom yɛ tɔso nkron ayɛ September no yɛto asi hɔnom sɛ saa bosom no nyinaa yɛbɛbɔ dawuro afa prostate cancer ho nti no deɛ di kan a yɛbɛka koraa ne sɛ prostate cancer koraa prostate obi ka sɛ prostate na ɛyɛ den ɛyɛ deɛ broni ato din sɛ ɛyɛ gland yɛ body part anaasɛ deɛ biribi a ɛyɛ chemicals anaasɛ produce nsuo bi a ɛde yɛ ɛboa nipadua no nti no yɛbɛka sɛ ɛyɛ gland na gland yi ɛwɔ yɛn yɛka sɛ ɛyɛ bladder yɛn bladder yɛ baabi a yɛn dwonsɔ kogugu na ansa na yɛbɛdwonsɔ no ɛno na ayɛ sɛ bag a yɛn dwonsɔ no hold no saa gland yi wɔ bɛrima mu na ɛwɔ bladder n'ase na broni bɛka sɛ yɛsɛ ne size nyinaa te sɛ walnut ne kɛseɛ nyɛ kɛseɛ bebree bia ɛbɛyɛ 70 grams so wo ka ne weight na te sɛ walnut na so fa so koraa ne sɛ ho hia yie ɛfi sɛ prostate no produce juice anaasɛ produce nsuo a ɛboa ma bɛrima tipo no anaasɛ sperms no ɛno na honam nyɛ ma hoɔden efiri ɔmunya aduane firi mu ɛno nso na mo stream a etimi de mo stream famu a mutimi ne ɔbaa hyia na ayɛ afɔme baby no nti no saa prostate ho hia yie ho hia pa wɔ kwan bi so a me kyerɛkyerɛ mu sɛ ɛno no yɛ ɛkwan a ɛboa ma friends ɛboa ma yɛtimi ɛtoa so awɔ mu ɛsaa no bɛma ɛho hia ma yɛyie ɛnso no ɛtɔ da bi a na saa prostate no cancer akyi no nti no ɛno ho hia ma yɛka nti na ɛsɛ ɛka ho asɛm na ɛbɔ ho dawuro ɛno nti na yɛtu bosome baako asi hɔnom a ɛde ka saa yɛsɛ prostate awareness month no yɛkɔ mu ɔno yɛbɛhunu dokodie nti a ɛne deɛ ɛbɛtumi ayɛ aboa yɛn ho ɛbɛtumi aka sɛ ebia bɛka sɛ ɔde ɔyɛ ɔbaa ebia ɔde ɔni prostate bi nso no ebia na wɔ nua bɛrima bi anaa wɔ kunu anaa wɔ ba bɛrima bi anaasɛ friends o papa nti no ɛho hia sɛ mbaa ne bɛrima nyinaa bɛtie saa asɛm yi dawuro yɛbɔ na ɛtumi aboa yɛn ama yɛtumi abɔ yɛn ho ban and it me catch ye kunum ye friends and ye ma ye niam bema any your friends and ye banum and meeting their bomb home by. You know, you did kind of make a one make two scenarios and I say abakasom yenua a see yankasa now made me who say the idea to me present here and I say the etimi siba wo nipa kwamo and bema kwamo into you did kind of make a bema be a new D in fear 74 bibini now okay no ne friends and medical history and I said the ne history mu a no oni yare bia oni diabetes oni heart attack oni bibia afei na busua mu no so na bibia niwa betima ka se sa yare ennamu na okọ ne doctor ho koye mpensemu na mo ye blood work na ye fresh blood work ba could be PSA ne chese edin kese ne se prostatic surface antigen and I say test bi a ye de hwe prostate no ahoden nti no ye test no na the prostate no number yi is so same 4 abro 4 so normal number anywhere between 0 to 4 nti 0 to 4 wo sa nkamu ho na sa number no normal ma obia ana say ne be normal ma obi wadi 74 nti on there na was ro kakra ebe 6 onum no na the doctor no because no any symptoms bia no doctor na answer da anye ho asem bia wa pɛ ho asem bia nka na nti na chire no ba se okakoye pensem move for because when you jaundice yeah I say boni because why jaundice na say why yellow kakra nti no koye ultrasound akotwa amfoni fa gallbladder no ni yemu no ma no omuhu say the prostate aye kese kakra nti no abra amoye jaundice no ma mu yemu say na ne bonyo and as a gallbladder na stones abamu ebo wo nti yi ye no wie no epe onyamre say ene prostate no mu say nso akese no nso no opepe ho asem aka nti no ope ho asem kan no sa koye na PSA ni biom na cost was ro na mekan na ebro 4 no so na 6.92 nti no hu okoko doctor what specializing and na say from urologist amuna mo ye plumbing no your friends saying Johnson tubes na your friends saying normal a boy match so no etimi bani nyina yam bladder ne de keke ka ho ni nyina amna me ye ho adwuma no okoko hu no ka say say ye biopsy njo ye biopsy no take is 12 samples na ampa emu 10 it turning out to be positive for prostate cancer you know biopsy ni wie na or church and normal different to betima here for treatment into treatment no na normal options ni be say be radiation and na say be surgery na opted say obey radiation into your radiation na men charge your radiation ni we no the prostate PSA na say test na dey share prostate na ho den no na fe every 6.2 eba 0.9 na who say na me adom ye yi yare ni kra free honom che say there so yes say ni say so cost na or monitor nti no we scenario ba ko a see mesan another scenario here onu de no ye younger kakra onu adi in fear 43 no time adi 43 no ko ye ni PSA no ko chichi o conductor one and doctor no ni yearly exam no o decide so be PSA no the PSA ni na 3.7 falling within the normal range of mekai 0 to 4 and so no 0 to 4 ni obia a normal range no doctor nka chen so normal range is correct okay into the morning bibia 3 years later no who say just kana so cautious yes one cautious bia now we go no ani ma sentino osako hu ni doctor na say PSA ni biom osaye PSA no akosro PSA 3 years before now 3.7 no na akosro drew 8.5 into no Dr. Nika Cance, would you win age near for Femka Crantina, yen try and treat for say beer infection being a cause so because infection so affected prostate now. It means my PSA cause wrong. You know, your year and say, oh man, antibiotics, we're taking it for 2 weeks. We're taking it for 2 weeks, quite you know, and as soon you know, some man, number you testing you, testing you now, PSA and the CLI was raw, 6.7, or say repeat you now 8.1. No catch and say, any, say, yeah, biopsy, you making sure say, cancer be any honor. Pinyampa, biopsy, no, now your friend saying, oh yeah. 16 samples, so take baby different 16. Then 6 out of the 16 positive for prostate cancer. Into na branty so ekoye no no the ekoye and surgery in a ye prostate cancer and so free one. Into no mama mu 2 scenarios are share your friends and perform amunya prostate cancer ebi. Na just 2 scenarios afi ebeko yakutie yaka prostate cancer cry gini betima ya boy ban bad gini betima hu say okay bia we na cause wo me both me video muntino we say me temaso na me ya me kuku hu me doctor na me koye hu bibi intino the medical can ho ye you can say boni beka say incidence of prostate cancer beka incidence of prostate cancer incidence of prostate cancer e chese sa ya re kura ye kan ho asem kura di nti kura ne hu hia say beka ho asem how common is it ye nipa hina mo sa ya re na ye hu say ye hwe American man mu a the second most common cancer among men. Misamin kamu biom in Sudia. Bema nyina say ye share ya rare cancer ekoswa. Number 2 cancer is prostate cancer. Into here unnecessary who here ye pass say ye be hu dero number 2 on the list. Now, ye we see for nyina I must say estimating say there were 1.6 million cases every year. In Kebio, or say 1.6 million people in a more prostate cancer or amphibian, you diagnose them. Now, out of that 1.6 million, almost 400,000 people in a aphibia from prostate cancer or prostate related death. It's not here, then American Kwan and war, not a war, your friends saying. Iriasi infananyina America hankwana diano omu say nipa be 29,000 people in a muwu aphibia from prostate cancer. That's what we say who here say see hunu be efasa yare ho. Na yehwe America nye bebia na the friends say incidents na common ho no baby wo ho no more common than others. Particularly, you baby before baby no, is much more common than baby before ni baby no. Into no baby to say DC in Maryland, honum prostate cancer no, who honum numbers no, is higher honum. Your friend saying incidents no to change. Next thing I'm person we no more discuss age. Say a normal baby may put you at risk of prostate cancer. Into number 1, age. The who here can see age. Age, I must say, age is the strongest relationship. Age is one of the strongest relationship between your friends and prostate cancer and human beings. Say, prostate cancer has one of the strongest relationship between age and human malignancy. The kind of the upper say, your prostate cancer. Very likely say you bet me the age and now saying fear ye atoto ho etimaka say okra or risk and or risk it same. You know, you mo say if you pense more. Among year under 40 years, be a 40, be on the 40 no, the risk of prostate cancer is very, very low. The highest risk is falling between 65 to 74. into 65 to 74 honom in a prostate cancer no ijira kese pa ye into no yehwe a omomodi 65 to 74 no hono na ejira kese but enche se omonko ana emowo sa risky the who say first one is age into no say yehwe a emomo ye emodi kan me kan say 65 to 74 we ye mu free hono ma ye wo emomo ye your friends say 50 to 64 no etoso then emomo ye 80 to 84 no then 85 years plus no answer your bar firma 50 emomo ye 50 to 50 to the friends say 64 na afi no wo mu ye nkra bi omo ani nhyere mfie no when fee bebra or risk of prostate cancer near less. It may say if can cancer under 40, very, very, very unlikely say ubenya prostate cancer and now say be diagnosed with prostate cancer. The year no free one more. The first year who say age. Number 2, ethnicity. You can't ethnicity you can't say you free say be before you are brofo, you free Asia. If you hear you know, who said prostate cancer is more common in blacks than whites or Hispanics. You who say prostate cancer before it any prostate cancer more than your friend saying a fetal for and now free Asia and I say a free South America for a friend will say we Hispanics. Say you share prostate cancer or America mine more. You who say you 400,000 men be before about 165 per every 100,000 men. Into 100,000 men, 165 of them. If I before and we 100,000, you move 165. It will be it was prostate cancer. Abroad for the NBA 99. That's all here and before the NBA more than your friends and 60 points above 60 men above before. Then I want to talk Hispanics. I'm with 80 into over 100,000 Hispanics and now say over 100,000 men and we are Hispanic origin. You move 80 in the Mubenya your friends and prostate cancer. Now I'm with this one. Asia for free say China ni India no mo de 55 na fe we no free honma no aba American Indians any Alaska for in a way yes study yam ye chiche mu sa na ye emu hwe wo America for your friends saying nipa amutikrom ha say intino who said before who here who here ma your friends say all ethnicity but who said before it the kind thing who here pa ye ma amo intino before no and yes say before keke who say when you fear no na sa ya re more common when before in the first you can age as we grow older your friends saying the risk of prostate cancer increases. Number 2 you can say will race and now say will ethnicity and also no here number 2. Number 3 is family history and now say genetic factors. Into family history so who here ye the family history you mean say be as say over pa and now say who of a be who be no or farmer near Bema and our penia Bema and now so brother be will be no sa who of sa family history now put you more at risk than Ubia when family history. So I who says I really dear Timifa can say genetics and I say to be me can because be a moja when you say be ma moja na benya. Yes, an American, but say be genetically no papa na mammy and I said if you free banner or bush your phone would be it mean increase your risk. Now the one is say and yes, I say papa na so mammy and will be so papa will be crying. Age a papa di nya ya na so uncle no di nya enso hia. It say bia wo of bia onya no below 65 then o risk no quite higher since obi a bia no papa bia na ne of bi nya no at the time anu adi 80. Into no so of bia na say o papa bia na say obi se ni bia nya bi at a lower age you are more at risk than obi a me of bia na no papa bi nya at a much older age. Into no me en kai say the di kan you can say friends say age ye nyine no bema ye nyine no na say ehwe ho so ye especially prostate cancer. Number 2 before there was some risk, more than a fetal for the Hispanics in Asia for before it was more risk than year. Number 3, who said family history, who here family history are dear back one, your friends and see who area a be minimum and papa and I often in before a brain sometimes then fire yari and kind yari and chain you and kind yarn chain my minimum ya papa no ne the bush for but I didn't hear ye if he says only be a cost walk would be all your bush anymore. It's no boama or bomb home by and I say, dear, I'm out to me a year quanye. And I say, you know, bit my shame muntema, wait my shame muntem up and one true. In the account of money in some way. Number 4. Pastor.
Yeah, me say church ma di mi kakra na mini ona muti so omuti ase. Ti say Uma statistics no. Me hu yen say ya tuntum no. Ya na e high risk pa. Is there anything predominantly at higher risk of getting prostate?
Okay. A very good question. Of course, Rebecca, Diane, normal friends, but sir, and no man so who take all those things into consideration as a be out here, Diane, DNA, normally Rebecca can hold here. We use no money in every mokrana, and we say somehow in genetics, a genetic makeup, you put you at risk. And yet very clear. You couldn't hear before your friends, but your who say from epidemiological studies, and we say before you're more at risk. Now, and maybe we're besides the family history and the genetics, then you are betting your control over a bit my boy, and then a bit cost what can was them. The friends, a bit addresses are no in next going forward. Now, going right into that, first one here, diet, a duania yeti, a duania yeti, and remember, honoma, a big bois, if you want my shadam wine cassia. Doma one wine cassia, must animal fat. And here we say, a duani bebria, sadie, animal products. You won't want to say, be a red meat, and I said, your friends said chicken, tomato. More fat woman. And we say, Sanomano, it promote more prostate cancer risk. In the way you are about Quebetimati and Wefrim. And you say on the converse, a diania, and I say, on similarly, a diania vegetables, ne incident anymore. And also put here more at risk. It is a over converse now, a diania, it me who give more vegetables, and it mean for a quite beast, it may protect and free prostate cancer. And what I am pensem, you will say tomato, friends saying, you have tomato more chemical be my friend like lycopene. You who say, lycopene, say a bois, it me protect nipa from prostate cancer. Lycopene, you will prostate, tomato more, it me bois and me protect. Say, who are risk granted to be aware, ultimately take his animal will be bit my actually quite. And I'm who say calcium, ne vitamin D. Calcium, ne vitamin D. Unfortunately, calcium, ne vitamin D. We say increasing risk of prostate cancer. Now, think as a vitamin D, any calcium into me. I can say, yeah, friends saying, yes, but make vitamin D, calcium, and free animal products, to say milk, any cheese, any yogurt, any dairy products, and no near who say your friends saying increasing risk of prostate cancer. Now, a piano coswa, who says soy products, into soybean, soy milk, and it's soy products. You will say your dream said there was some chemical bioma. It is estrogen. Estrogen, and bar hormone. So, who says estrogen, and more with these soy products, somehow a protectium. So, a dear mamma, hypothesis, and answer my suggestion be said, a beer na Asia honum no the could prostate cancer any hobby brainy because we use a lot of soy products. It be because we this soy products in the brain at compared to other places no. And in prostate cancer no. But statistics they share any America 4 Asia 4 na more America na share more before more America. Into no share idea na papa but you say Asia 4D soy products into soy products na boa or Kwame so. Yeah, yati omega-3 fatty acids, any fish oils. Into omega-3 fatty acids, ya can want some say a boa akomano, a boa reduce your friends or cholesterol or Kwame so. However, no, you among pension say, sir, a normal way saying and shudder and boa be or prostate cancer. It doesn't help in prostate cancer. If anything at all, it increases the risk. Into now who say a normal a boa prostate a boa your friend saying duania itimidi my boy prostate cancer a normal first of all who say you did more fruits and vegetables are more vegetables are a boy a quine be so say yeah home let's say to me it more tomatoes I want lycopene and also boy or quine be so ena your friend saying young to say a beer and normal bit to say animal products and non boying or a quine be brave so a bit more increase or risk for prostate cancer. You know, you free honoma. The next thing I perceive the sex hormones. You got sex hormones are the year cano, you can't in Bema mono your hormone in Bema a important word you mono your friend testosterone. Into the conformity bray a pension mushia say crass testosterone yeah a one Bema mono. The level say bia obia de nyepe omuhwe say bia level no affect prostate cancer na say bia omo de was no does it put them more at risk of prostate cancer omo de wo fem no does it put them less at risk of prostate cancer woni mu omo ye research amuhwe mu no omo hu say sa the level of testosterone no, it doesn't have anything to do yet omo hu say or anything to do with prostate cancer. In 9 who say a Kwame Brasono, Sadi nya bit me afa a cat we say. Number the next one I'm obesity. In obesity, a dear bakwa, who say obesity, oh ye can see a broswa, ye can say affected diabetes. To see so ye can so say obesity in some boa in my prostate cancer. Say a beer why can see a brosua ne so fuck quine bisua a beer by your home as a sound or lifestyle no try so battery because cassia brosua moon say and no no emboa prostate cancer. In a demicos way ya dear question cassia baquana coffee who say number of times they are on your bad and so yeah or ejaculated, does it affect prostate cancer? We say yana there were a lot of discussion about say beer amoka say beer or bema be on beer on or band be brain no and say only a lot of sexual activity no or increased prostate cancer risk. Now two studies are some studies in a retrospective, because retrospective, as you say, go for cancer, we na ye because say your friend saying a muntini, say more fun for mania cancer, and we share a more lifestyle. One say how many times they be a munya sexual activity and now say a more year a more jaculating. Now, a more year pensum 2 studies. That are 2 studies in our show say Bema during the time or between the 20s and the 30s now. So during that time no, so there or a lot of encounters, sexual activity encounters it may be to be protected further on later on in life from prostate cancer. Now, sir, your friends studies here again are limited. You can say a limitation or limitation because the more you say I'm more share back na mubusa nkrofo say how many times na bia we did between 20 and 30 now how many times na maybe when your best share now say now we ejaculate into now our limitations but so 2 studies we show say remember amo can say amo ne amo year between their 20s and 30s no amo ejaculate about 21 times per month compared to obia or say or in your sexual interaction 4 to 7 times per month no between your 20 to 29 ages no amo ka bebre na amo ka say 21 times no amo no mu say much less risk of prostate cancer than compared to obia or can say or less, and this was only limited to the period of time and between your friends saying age between the age of 20 to 29. It won't say na study a quite bit a bit more per moaba and so no limited takra. Okay, into no sa a normal way say a normal me di kind no a normal ye bit my who bibi. Number 1, aduane a yedie ye keka bebree fa animal fat ye kan ho fa tomato ho ye kan fa your friends and soy products ye can say calcium ne vitamin D a ye nya ne free milk ne dairy products and share them boy bebree ye can say your friends and soy products you're very protective you can say omega fatty acids and share them boy or quite bebree so about prostate cancer you can say hormones remember hormones or testosterone higher now lower and affect prostate cancer. You can say obesity increase your risk of prostate cancer. In a can say studies are show say Bema must say I'm name bad ishia and I say I'm ejaculate more between the ages of 20 to 29 or more later on a protect more from prostate cancer. That's all.
But you my person maybe some question we say now say what can be differ lycopene. Na when him say kuro mu atim tomatoes dose pa species ni bebree. Nketwa wo ho na bi su ya kese na bi su kese no kura bi ye round bi su ye hwehwe. Enti sa lycopene a wo kan wasemi bi wo tomatoes ni nyina mu ana bi wo abi ni.
Ti lycopene no nyame adom wo tomatoes ni nyina mu. Eno kan ho na ma nya sa na red color no. And it's like lycopene no it work tomatoes ni nyina mu like you can see around a vine or a nketwa friends ni nyina nyame adom ni nyina wo mu the be say sa lycopene na say process tomatoes na e destroy na sometimes aduane bebree no process bi a wan ho an sa no na lose nutrients ni bi wo asila no sila ubenya even grass me can simple say bia tin tomatoes ne tomatoes ya kan ne se wo no ade ye nko wo de ye abobon na ade we ni nyina abwo ebi wo ni nyina mu bi but ya ne ye no aduane na ya ne bi wo na ya destroy some of the nutrients na wo mu no but sila no sila benya bi wo
Question that toss me no omega oil na oka ho asem say yeah na nkofo kasa omega oil a very rich source of oil boa vitamin D ne manema ewo ye free mo de boa ye nipadua no to the sense say ya bi kura capsule de madru and this say no ye hu say memman so increase high risk of PC enti no Kwame so na say me ye mame ye prescribe do to say omega oil mame Kwame so na me fa so a de be nsusanso no na me bi na ho say bi a bitima de abam so
very good question. Into no omega friends and 3 fatty acids no who said there's an increased risk. However, you who so say a lot of benefits when about cardiac your friends say by a common more seminar and he's saying it may reduce your friends say triglycerides and now cholesterol no or quite be so now cholesterol and triglycerides yeah and then the couple that or blood vessels now more it heart attack no now a bra as yet into no we share a quite be so a bois a quite be so honma and shada you who say there's an increased risk into the mechanism normal and maybe one ma a quite be one ma a bois na no be one friends say na say a balance into say o doctor ahwɛ no who say o triglycerides near high and also your friends saying cholesterol no normal no say beboa na catch you say 4 grams as a capsule there no bia na say who say and no benefit no even though I want risk no outweigh risk na yes say a bit more increase your risk of prostate cancer and PC no into no quite the brain no so no no my no na ye weigh no balance mo ye weigh say one more sense affect wa na say say ne eboa into the time be beka say you know if omega your friends and fatty acids no na who say be a beboa akoma into no no sa no o fa ne sa na eboa wo say bit ma increase your risk but no be wo hon so bit me na ya bit ma reduce your risk for prostate cancer. Okay. Nti ye koso asese no we obusa se na me kra de atima wo kan bebre ne bene kra no mahunu se prostate cancer kra no obi anase me nya bi anase de na metima ya metima bom ho ban de na me nhwehwe for nti no ye di kan ene se unfortunate but quite business no a bit by who bibi ene se very rare say obi be presented with symptoms for prostate cancer. Into prostate cancer ade a ebetima show ho nso na ebia unim the see me see kan no share your blood and acid na ye ketewa bi na show ho sometimes no ebia na ewo ho no a atochima nso na ye nim ekwan a ye behunu na utie ye na se bia onya symptoms na so wo hwe out na ebi ni se bia odwonso a na moja wom nti se be ma odwonso na se moja wom a who say enye common enye normal enye ade a ese we taking a likely cry enye ade a beto to na se cry ebi won ma bia ni be ma bia be ma oni oba da na se bia o sperms ne ba na se moja wom a eno nso nye normal enso ya ade a ese wo pe ho asem na wo hu doctor intentum ebi ni won ma sometimes ebi a wo dwonso a untime dwonso be ma bia oni fika cry because person dwonso a try so dwonso no mbase de esi ba eno usually no ebi na prostate na ayekese na me adom thank God most of the time the prostate ayekese a and just say prostate cancer most of it yes say prostate na ono so ayekese na o ma untime dwonso the friend benign prostatic hypertrophy and BPH so BPH is much more common than prostate cancer but se bia udwonso na so untime dwonso a Mr. You not go doctor because a quite bisono, a bit my say prostate cancer na presenting like that. Ena, if one man just so kawa, a beer, just so can one chumika and pe bathroom be and cosesia, ubegu when you was it. Sa and finance on see be a prostate I can see a irritating war. Into the sa a dear as a ye, say be a say, utime just so kawa and whom he also baka Johnson, but all of a sudden, we are just so can happen to me Batma. Sadia to me born kaye, say, and so cocoa friends say, who corner a cautious say, BB or Honma. Again, we submit my a sign of BPH, a year benign and on your cancer. And I said, dear, what Johnson on to sign, if you are not a what dear edit one, a swab brassy. Sir, your friends saying, symptom they are dear very common. It will BPH and I say the cancer no near cancer prostate na keke and so no cancer so to me man yes sir na e bia anajo to me that sir sorry so all of a sudden afi anajo na bia so sorry we sorry 1 or 2 times so and ya dia so bon ho kaye ka say dia na ekoso yes sir na mete and so no unfortunately no most of the time no prostate cancer will honoma unya symptoms we are engineer say ye hwe kwan foforo a ye betimi de ama yetimi ehunu ntem because cancer de enyina is throat cancer nanso no unya cancer na so unya ntem a kwan bebre wo honoma betimi anya treatment etimi anya cure from it na say ye betimi atu yare na sekura
yeah doc with symptoms here working na obi o na ono so na wo diabetes a ebia onya higher blood sugar level at me man just rough sa the converse now betimi ehunu so yeah that prostate symptoms and diabetes symptoms
Very good. You know, obi what diabetes symptoms, you know, your friend saying sugar cholesterol and pa when say woman akako Johnson sure so tell be an so called Johnson because sugar ni person about. The sugar ni be back out for urine no. Prostate Diana, say wo ka Johnson sure na, ebi one ma boy say na bia wo Johnson ahoɔden nim. You know, strength na ebi a wo de to Johnson ebi a encourse dey say ekon. Ebi kura wo person wo Johnson na ebi a so we try so we chim kakra ansa Johnson etimi aba nti no na otime release Johnson diabetes in ma wunya sa symptoms diabetes dey be yan say we story akako Johnson sure na say living crown is overlapping na say when in doubt now it's always good to have it checked out because e be an diabetes but e be so ana because what diabetes and so what diabetes and diabetes no man intimi intimi and more aware of himself, man, in try say, or be taking precautions, it is to be taking precaution, maybe some boniatono. Until say, if be or diabetes, all of a sudden, no one says, so sure. That's what sugar, yeah, good. Sugar and be a control. That's what we say, before for an echo. Say, be or Johnson, and that's what we say, Johnson to sign, I saw Chimka cancer, Johnson, Johnson, that's what we say, and yet diabetes inquire a be a little before from one each. They know better my boy, what difference. You know,
me pacho, na, no, what Johnson, yeah, who sign be as a pain be woman, I say, pain be himself, who doesn't have pain be woman, na, the be as Johnson no bash, no, dear Ben, the days had anybody.
You know, usually now prostate cancer and cause pain. Initial portion now, initial time now, we say we now we born home by now. Sometimes then cause pain. Usually now, unfortunately, cancer most of the time the cancer and cause pain. Say shasia. Ebe cause pain in the time I started a didia comuna a be a spread a be affecting nerves a be na a grow too fast. It do that time now a cause pain now. Usually in a bit that time maybe a corner new year. You know, say be as a kind of breast cancer now say. Any type of cancer, and usually no. A beshas now, Satama ubetimi and who in Tema and Kabetima bon mobile and cause pain. So what Johnson say winya pain. Most of the time, no, not all the time, but most of the time, be an infection. Infection a man cause pain to be when your urinary tract infection, and I say be when you be a friend of prostatitis. I know see infection of the prostate. And no, usually no near cancer in so Johnson and pain most of the time no the infection. Say prostate cancer, and I say prostate cancer no unfortunately maybe a dread check a crack and start affecting nerves. No. Now you see a wound in Ntim because wound in Ntim now bet my young BP a bit my protect you and I bet my cure crack from it. And no, yeah, wound in Ntim now so utritia, then you have that cure from it.
Yeah, talk with you. Me my own chair. Me say question. I don't know what say ehunu. So nti ehunu ama wayas ho ehunu nya kese a obehu.
Nti na baby a channel enya de a a hidden and I say a share wayasi honom na e show blood ano ene bone na wo honom no. Nti na ehunu kese ma unhu say bibia betua honom because abontin honom no bone na wo honom ntimi honom fa bone no by the time we go bone no na I started a cause pain ena the bayan says hono kosoro na e push bladder no nti na no the mo hono ni say bladder no e ma untimi na be affect Johnson ntimi mba sho say they say si bana na say e be ma time bia na Johnson di wana say e bia na your friend saying Johnson di one pen ho asema nka na be Johnson go ho. Nti no baby a shame nti no by the time I say bia ntimi hunu ma unhu say aba bonten a bet ma say oh ade pompo na abom ha say a e ba bonten bet my nti unfortunately sir ene ma ne ye tricky kakra.
I'm sure okay bibi fa sex no. Nti say me obi na say ahono me ne me yere ye sex a Kwame first ejaculate no enya impact bia enya me ya na bibi sa ma me hu se bibi di sa e wo ho.
You know say your friend saying join ejaculation no the betima amotima who say be sa or honum ye say be as affected blood vessels ama mojaba ejaculant no ana say semen no a ene beboa wo but say pain pa say there unless a drew a mirror accord into the nerves no and affecting never enkoso pain to say there ebema your friend saying when you're pain in pain there yeah usually no cancer pain probably almost to the end now. I started spread it, I could bone no, they grow too fast. They were saying, but say during ejaculation, the baby say affected na affected semen na ebano. Prostatic juice na produce na be na moja abem. Intina and ube who moja wom. But pain per se party and yet very common symptom ube.
Yeah, out of curiosity, obi bu some questions and a man so mutimi prostate.
Na me adom mba ntimi nya prostate cancer ni bi. We yem be my area because mba any prostate. And you know, emu ni bi. Your friend saying, ade a glanda mbema ne ewo. Nti mbema na ewo sa glandi ewo between amo bladder any amo bladder ne your friend saying, amo perineum honum no muscle ne ewo honum na ehye. Mba ni bi nti no nyame adom mba de mo protected enso no hu hia se mba betie sa asemi because e bi ana wo kun bi ana wo ba bi ana so wo papa ana wo ofa bi a o pena asem yi ana wo nipa bi a woni ni swan a wo betime de sa asemi ama no a enso be boa na okwan bebre so nti no ya koswa then ya hwe signs and ya symptoms ni na wie no then uko hu doctor o doctor timi palpate or the safa otu ho honum na so tru mu honum no na or the try so or the be feel prostate na see them see the kind no prostate no it was between bladder no any rectum no any muscles e wo honum no intine so the nsa hye honum a e bi wo honum a otimi tenensa e feel prostate na so prostate na ya apo a e mani timi say we dey bibi wo honum a e say e kohwe however no e say who say doctor ne den nsa hye honum na nyeta bia na otimi feel because baby a ben your friend saying rectum honum no eno honum no betimi feel say e bia e ben bladder hona o examine a onya ontimi examine wo hontini we no eboa but the doctor en feel bibia en chese bibia ni hono intino then the next step sa PSA ya me di kan PSA ne ye protein and say ade bi a prostate no nko na prostate no nko na produce sa PSA no emba ini sa PSA ni bi emba o sa PSA bi na sa prostate na produce sa PSA no numbers na ye nim say usually no between 0 to 4. Internet said, "Uko doctor on so general physical once a year or corner so check it. That's a PSA a cosra. Then I saw to say, hey, dear ne coso, I menya prostate cancer. And I say, prostate cancer going to do my PSA in cosro. Prostatitis, some kind infection, bit my malacosro. Number 3, a bit my say BPH, bit my malacosro. Internet who here can say, sa PSA, a bet check it. Usually in the recommendation is say, Obia already above 40 BR because if the guy can say below 40, prostate cancer is very rare. But Obia would do more than 40 BR and so check it. Unfortunately, I say dear when your prostate cancer be there, then Oba say dear when you're 45, then Obano and say no on train do 40 as was start checking. So checking about 10 years before that 45 and it so no start checking 35 on them. Now you share number, then we trending number and as a number no costra and you to be born kayema who say Diana air costra. Into number 1, you look out for symptoms. Number 2, PSA no and who here. Now PSA no crano, your costra come and we say me can say between 0 to 4 in a year normal. And also no and yes, because so called different age category. Obia they different. It is a be between 40 to 49. PSA no, I say anywhere from 0 to 2.5. Even though a 4-year normal, no say be a 3. And so says 3 no, too high for you. We are between 50 to 59. PSA number is 0 to 3.5. And so we are 60. We are 60 now. Equal now 0 to 4. In the can say a normal for BMBR. Intino, dear, and who here can see and he said, they do more than 40 every year. Biano, and say, O'Connor or doctor check you out, and say, O'Connor or check it, say, or prostate level, no, saying, and say, or check it, didn't answer examine or prostate, and we say, a pobia one, and say, I can see a broswa. Intino say, your friends, a doctor, no, yes, Bibisa, no, who's symptoms, and answer who's a baby cosusana. The next step, and they say, so or your biopsy. Into the biopsy, no, a very little procedure will take a sample or the needle, you are taking different samples from different portions of the prostate. You take samples now, you take it now, and the one will say, ampa, you be a honeyman, now say, you be saying honor. Into the minute, the trap, the yama can be here, but the mechanic say, the nipa be brain me sure say when your prostate cancer, person who said, na adi kra a quite ben sooner you treat it yari. Number one, you can't be your friend be active surveillance. Active surveillance. Active surveillance, yeah. In Bema, a be a prostate cancer, be an amania fee. A be an a D 80, 90, 1 no man. Now say, be an the prostate cancer, we are in a cacrabina, almost affect prostate in cacrabi. Almost ano, umutimi case, yeah, dear, ye beshe, ye be coswashe, I am pensemu, a beer, afibia, a yem pensemu, and prostate cancer now. And now say be a 6 months be a check PSA no a tram for ye I say spread ya and I see it's it will say spread ya and I say yeah at that time no never your treatment. So active surveillance no dear ye timi to say and no sano and ya dear ye treaty sa prostate cancer no, at that time. Number 2, it be treated prostate cancer with surgery. Surgery a kwine back one, it may be prostate cancer. Uko surgery na urologist no, and bet my surgery no, be the robotic, and I say we track it to heavy and laparoscopic, nema comodium tubes are come, nema kaku prostate in every one. And I say, the woman to me track a say, then so no, ye prostate cancer in every one. Into number 1, the active surveillance. Number 2, surgery in the cure. How we say. Then number 3, so that it may treat you with radiation. Radiation, you have 2 types. Radiation, they are kind it may external radiation. Yeah, best explaining say, okay, now a market area honum no, that machine or honum, it was that machine, no, a mouth radiation therapy, no, it be a overcall for maybe a Monday through Friday, maybe I'll call 40 cycles, and I say, Dr. Nibeshesi, how big it is now when you're radiation, to one surgery, out near radiation. Another radiation type be one my friend of brachytherapy. And no, so yeah, idea. The more say surgeon for radiation seedlings, and I say radioactive material. Now or the same radioactive material, no, what they share prostate, in chain. Into radioactive material, no, a burning off, and I say a blasted prostate cells, na accumulating in every honor. Into and no, number 2 it me and a friend of brachytherapy into radiation, either say external beam radiation, and I say brachytherapy. And sometimes you could be a friend of hormonal therapy. Hormonal therapy, idea, who say Bema hormone, testosterone, I'm D kind, and causing prostate cancer. And so no, say, I say, what's with ya? Now they petrol abuso. Testosterone money, Jano a benny pie, and I say, my friend saying, gasoline, and I say petrol, and I say gas, no, Emma, my friend saying, Emma, a Jana benny, Sana testosterone, ye. Into say, and to me, and surgery and prostate cancer and few and radiation and cook prostate cells and answer cancer cells now. Then another way and say you treat you with hormone therapy. Hormone therapy now a quite back on say ebe ma withdraw and ebe ma injections bi a ebe ma testosterone levels no aba down aba fam ye and I say the mutimi ye no so say bema testicles and I say you can say you can cast mo sure no ye free honum because honum na testosterone is free back into say yentimi get surgery intimi in prostate cancer ni free honum and I say intimi get radiation therapy then if you bet me withdraw ebe ma testosterone na confirm and I say sometimes you know omuyi testis ni free honum omuyi testis ni free honum na I say testosterone levels na ba fam and finally say unfortunately no say be a prostate cancer na spread it called bone a spread it called lung a spread it called sometimes going to be spread it called brain so a spread it called brain a spread it called baby brain then sometimes you know we use chemotherapy for advanced prostate cancer chemotherapy na and no targeted cells na what a spread you know any prostate cells you know now try say it be kuno off and some people so honma if you want maybe I'll be in the near fee a beer say any of these treatment now and no crab be kuna and say beer or noa I may be friend now or friend you know your friend saying if you are now sa treatment no na make say 10 biana ya balance normal it is a treatment no be kun compared to your friends saying yare na crab be kun dia then sometimes go for be one ma yenye bibia and no say behwe say bia say a cobble one na say ko baby a near treaty e be a pain and na say bia say or problem with urination e be near the catheter show and na say and no say no your friends saying just treating the symptoms now prostate cancer na cause na to wrap up no mesama can be treatment no options no number 1 your friend active surveillance they say who are rare no your mal treatment bia you watch you closely you say kesi a you be treated but enya kesi a you watch you closely so your symptoms be be treated you know you watch you very closely to be every 3 months it be every 6 months who call your blood work and I say who call your friends who could try for knee if a prostate number 2 is surgery you know you bet my surgery any kesi a ye twa kesi a wa yasi one and I say sometimes na mutimi small the friend robotic or radical robotic surgery and also laparoscopic surgery and small incisions. Number 3, radiation therapy. Radiation therapy, no, 2 types. It be a donor machine, no, is sending radiation, you know, radioactive friends and beams, you know, to kill off the prostate cells, any cancer cells, you know. And now another option, yes, the seedlings, the radioactive seedlings, share prostate, you know, any local therapy, radioactive therapy, no, kill prostate, you know, now number 4, hormone therapy. Either say a bema a drug reduce so bema hormone a friend testosterone, and now say the beka you testis nephew honum. Mika testis and mika sure no bema sure ne be sa testis everyone testosterone level na confirm testosterone and cause prostate cancer. However, no, I said the other gasoline go fire so it will it burn more. You know, open so brass ya utimiesa. Now the treatment in the chemotherapy. Now chemotherapy ni reserved for say be a spread baby. Now there no yet treatment, but say be your friends saying obinya prostate cancer ni who say treatment in the kuno cancer or no the beautiful bikuna and only a young horse you try say if I so a normal symptoms are if I call in a friend say Anna. You know, with my basis will be a question be an answer.
You're doctor that was a me wa question be a mebusa na because me that was your time is way spent. Ya man temuti o me break akra be na etima ya dia bidu dia edu. Na asamo ehia me anze ehia me mapa yi. Be ma bi ho no ma onim se me wo me nya prostate there se me koye these 4 types of treatment out there my but me sure say me koye ahwe na me be man so review. What is the percentage of say me koye me be ma intimi so review as against me be ma beso?
Okay, very good question. When it depending upon the type of treatment we go through. Percentages really depending upon type of treatment we go through. For instance, say treatment be to say your friends say radiation therapy. Radiation therapy hardly never affect say be impotent. And yet a very low risk of impotence. I know your idea back one your friends and treatment back one we bet opt for who said who compare radiation to surgery almost equivalent say because almost equivalent in terms of effective efficacy in treatment for the first 10 years almost equivalent who said surgery is a little better after 10 years say I remember surgery was much lower risk. Into radiation therapy, it was lower risk of say a cause your friends saying impotence. Surgery was higher risk of that. However, no surgery, it depending upon surgeon or because a surgeon or your skilled surgeon, why yet surgery way be bria. Then our less complication with prostate and with impotence saying will be a only sad on your baby no when you say your friend saying age udinya yare no enso can no influence how frequent or how otherwise your friend saying prostate cancer no because impotence no complication will be nya it is a be surgery at a lower age between 40 to 50 honor you have a much can say be about 70% of your friends 30% risk of impotence, permanent impotence, whereas so a be surgery a be no 79 75 for corner risk of impotence higher since will be or younger usually after surgery a be up to their first 6 months to a year will be temporary impotence but depending again upon the age your friends saying surgeon skill in a bit influence BB to say other things like active surveillance and it more it doesn't affect impotence in a hormonal therapy would typically not affect impotence as your friends saying it will not change your friends remember potency much. It can affect the kakra because testosterone level no low, but affecting kesiye pepe to say maybe a surgery. Then number one affect side anymore. In a chemotherapy so no sign so affecting first was a question with a straightforward question, but I can't be brave because even though it's straightforward question, it depends upon the modality of treatment. Surgery being the one that has the highest risk of impotence. And the other thing here, age, if I call you treating in a person may experience some temporary impotence, but typically your friends saying with time potence in a cyber back. In a say God forbid to be quite in your impotent. Say more different your friends and treatment options including your friends saying penile prosthesis say implant it will treat your friends and impotence.
Yo, Dr. Ntim, cardiologist or Florida, or practices here, one of this hard to say a brain. In himself, move a bit on my Yanamuti message, and I do a modern. And into your Kwame say, your phone numbers 24028026333 no. A woman your text number 510931096 no. And so bet me a test to question be our person who say BF because we are this year oko top. And I say, when you be a quiet church or Saudi, we will be baby. Just a basa era one line so Hannah Ubenya Santi Chim, question our person who say be an house on a bit when you're free. Into your some munya message, I won't share to people now. Mono who Pebua, Shema Papa Monre, who Pebua, Shema of our own be a Sherman, mema ya de nkwa ne kan se na hu yie bi se mema bebre ho na nya prostate bi wa yenim nya bi zo ma yenko test kra the science ne treatment ne ho ne menyina na Dr. Ntim Agyeman na se mpesa me da Dr. Ntim aspa yie yenim se next week no questions bi bia no be ba mu ma so what when yakwa chichi ma chire nyina na me mfa wonko omo hwe so da mu nyina na oboyire ne obusuafo nyina ye be hia bio me da wase pi era 1 and health is world protected no na ya chire chine bebre ye de nyame jatiefo nyina nyame hyehyira mu nyina maba
Yes,
Hope Series 2022 Brenna so I feel a chairman Hope Series in a butu. Now so I feel we dear Ampaya Epidra. At if you some that's one say suffering Maranatha say how I been dear ya rear matitie we can't adebechie minka den majadien ni nyina mu no Yesu eba ifrasie August bosome no edato so aduasa baako eyewukuada no wie September bosome no edato so edu enefo du ano de dwumadie da bia obefrasie no nson ye wie no nwotwe ne fa na minute aduasa eto aso no ede yem paibo enti fa amane ohaw odadwene ene oyade nyina bra ni nyina mmom emom paye nyame paibo tiefo obetie yen osofo Emmanuel Kosisapon ana obedi dwumadie animu so pese wutie ana wo hwe dwumadie bia Zoom number no is 771-698-3733 password no is 777 Facebook to make call Chicago Ghanaian SDA for one Facebook anyone YouTube radio ni TV ahodo yi ana wono nso efa ato apete ewiasa fa na nyina Echo Radio ewo Chicago Yonkodo Radio and TV ewo Canada Trinity Radio and TV ewo Canada Era One Radio and TV ewo Washington Otaibo Channel ewo Washington Obra TV and Obra Media Outlet ewo Michigan afi KK Radio ewo Washington afi Hope TV and so Ghana so open kaibo mu atie pa for number this way 872-214-4159 Hope Series 2022 Suffering Maranatha
Sampa bietia Chima fidi non kotu Era One Radio Samupe Jumpa bietia Chima fidi non kotu Era One Radio Oh Ayum pamchima Chintu Asam pamchima Chintu Agratum chima Era One.
Seventh-day Adventist Church, the new Tafu members in the diaspora virtual homecoming, 3rd edition, coming up Saturday, September 10, 2022. Time, 10 a.m. EST, 3 p.m. UK time, and 4 p.m. EU time. Akwanhwefo, adofo ne abusia wa chichini benchaye e brana draw. See a posua near to Fapimpa, my yekoi, then I'm saya so I'm a puntu duma hodua, Yafati Onsono, a frat dumo kwa dumo kunim diemu. The new Tafu members in the diaspora virtual homecoming 3rd edition. Afe 2022 idea, a bear song kra. Jumedi no bear crabbe, and yum tofu a kukudam, behui and yum papabi, asidani a dance here some betoja, Nashayana Jawa so young cropon trade and pabasai free and Munyam, and now say young coupon near a dinner. Kai say a fee a bear fundraising, nebe kikim, nebe bonfrete. Yenina, crabby baby virtually. Ama a quono to Juma Arie pay. Our aim is to raise $40,000 in aid of church building in the Volta region of Ghana. Sasika yebe ebedi Juma Huduopi. It will serve as a community center providing health, literacy, and other welfare services. Jumadie baso eboboso me de tosudu ewo afi mpemienu ne aduonu mienu mu. Saturday, September 10, 2022. Johnny via Zoom meeting ID no 5559769072. Passcode 662377. Time 10 a.m. EST, 3 p.m. UK time, 4 p.m. EU time. Shannon Sosa dress code no, wear your colorful Ghanaian outfits. Nama events no, enye kejiwa. Yang guest speaker, Pastor Balfour Ochisi Abo, New Tafo Church Pastor, Kumase, Ghana. Afi Jumadie, ebe ye nika papa bi.